everybody, Alyssa here with Preferred Physical Therapy, where we help people age 40 plus stay active and independent, live free from painkillers, and avoid surgery. Today I'm going to go over piriformis syndrome. For the Technique Tuesday, we went over a couple stretches to help stretch the piriformis, and then in the blog we go over a little bit more of a broad overview of what piriformis syndrome is. So I just wanted to dive a little bit deeper into that and some tips or techniques to help prevent that, or some of the possible treatments, especially what we do here at Preferred Physical Therapy when you may have that condition. So the piriformis is a small muscle that runs from the very lower part of your spine out to the outer part of the top of your hip bone. It's a really small muscle, and in a lot of people, the sciatic nerve runs underneath it. There are a small population where the nerve may run through it, and so that's why the most common symptom is that sciatic type pain, running down the back of the leg, pain in the buttock. But some of the things that can help differentiate if it's coming more from your piriformis muscle versus something a little bit deeper into the spine or more out into the hip can be, some of the common symptoms are similar to the sciatic, where you're getting some of that numbness, tingling into the buttocks. It might be pretty tender actually over the muscles in your butt area, and then you find that when you're sitting, you're kind of shifting side to side. It can be a little bit uncomfortable, especially to have that weight on that side that's affected. You may also notice pain with sitting that gets a little bit worse the longer you sit, and that it could worsen with more activity. So when you first start walking, it doesn't seem to bother, but then as you walk a little bit longer, it starts to irritate in that butt, and it might start radiating down the leg, getting more intense the longer you go. So the causes, a lot of times it's hard to figure out what caused it. Sometimes it might be from excessive exercise, like you just started a new routine, maybe didn't build up into it very gradually, just kind of started going for it, and so excessive exercise, especially without proper training period. Running, a lot of stair climbing, a lot of those single leg activities can seem to irritate the piriformis. And then as well as just maybe you went on a vacation, did a lot more walking uphill, more stairs, just a lot more walking in general than you normally do. Also can be caused by an injury like directly to that area, but that's a little bit different to kind of tease out if maybe you fell right on something onto your buttock, or had something very specific happen, a little bit different. But some of the risk factors for this can be, again, prolonged sitting, an increase in your activity, especially without a proper training period, and then again, like we mentioned, just doing more stairs, more running, more of that single leg activity, which can put a lot of strain on some of those muscles in the glute. This condition is a lot of times confusing to diagnose right at first, just because it can kind of present similar to that sciatic nerve type symptoms that can be coming from your low back. So it is a good idea, if the symptoms are lasting a little bit longer than a couple weeks, to maybe see a healthcare provider to help tease out where the symptoms may be coming from, and to make sure you're treating it properly. Left untreated, it can just become a lingering nuisance, where a lot of times if you get on it right away, it can get away pretty quickly. So some of the things we do in physical therapy may be to help you stretch the piriformis. Also, we tend to find that a lot of times when people have weak hip glute muscles, there is excess strain on that, so we do some strengthening for those muscles. You may be having some gait abnormalities or running abnormalities that may be contributing to this, so having a provider look at that can be very helpful. And another thing we really do often in here for the piriformis syndrome is actually dry needling, where we'll use those needles to get right into the muscle to help decrease the spasming that may be happening back there, to decrease the compression on that sciatic nerve if that's the case. I like that treatment a lot. It is a little bit more aggressive, so we don't always hop to it right away, but definitely beneficial. And so again, one of those things where you just want to be cautious of sitting too long, and you also want to make sure that you are getting up often. Really, with any condition, arthritic type pains, things like that, frequent exercise is definitely going to be beneficial, but trying not to overdo it to the point where now you're getting that burning pain in the glute, or you're causing yourself to limp and then just walking through it. That just tends to perpetuate the issue. So if you do have any specific questions about piriformis syndrome, feel free to give us a call, drop a comment below, or reach out via text. Anyway, we'll get back to you, and I hope you have a good rest of your week. Thanks for watching.